culture, cultural sensitivity, other issues of the day that impact this vast and diverse country. Join us for Talk of the Nation, part of WNYC's outstanding News and Talk lineup, weekday afternoons from 2 to 3 on AM 820, New York Public Radio.
My guest on New York and Company is Thomas J. Moore, who was a prize-winning investigative reporter for the Knight Ridder chain of newspapers and the Chicago Sun-Times. He has written 3 books about our medical system and is currently a senior fellow at George Washington University's Center for Health Policy Research. His 3rd book is Deadly Medicine: Why Tens of Thousands of Heart Patients Died in America's Worst Drug Disaster. It's published by Simon & Schuster. And you report that one researcher said some people had to die, but they were dying anyway. So how clear is it that these drugs killed these people, or that the heart conditions might have killed them anyway?
It's very clear that these drugs killed people. The definitive study that done at the National Institutes of Health showed, ironically, that the people who were healthy enough to tolerate these drugs had excellent prospects for many years of life if they didn't get these drugs. And so there is no doubt, it is true, this is a patient population who had heart problems. But a person who has had a single heart attack actually has a somewhat higher death risk in the first year after their heart attack, but after that has quite excellent health prospects.
In fact, the NIH study was done because DuPont paid it $6 million to test their drug called ethmosine, and the NIH halted the trial because too many people were dying.
It's another cautionary tale from this story. One of the reasons that the proper testing of these drugs were not done was that the FDA got itself persuaded that it was just too expensive for any single drug company.
What about politics? Because Bristol-Myers enlisted the Bush administration to halt an NIH press conference on NCAID, their drug.
Well, it's again part of this whole story that I've tried to weave together for the reader. As you see these drugs, if you will, get in trouble. It turns out the power of the pharmaceutical industry to reach to the White House, to cough up millions of dollars when they have a study they think will make their drug look good. We are dealing with an industry of enormous power and sophistication. A large drug company can see maybe 1/3 have a salesman in the office of almost 1/3 of the nation's physicians, probably in a week or two's time. We're dealing with media, political, and marketing muscle of truly awesome proportions.
In fact, you point out that drug companies spend more money on free samples and gifts and marketing than on research. And yet, whenever we talk about the high cost of drugs in this country, the drug companies always say, well, if we cut back on it, we're going to have to cut back on research.
This, in many ways, is the biggest scandal revealed in Deadly Medicine. We talk about needing to test drugs, but of every 25 cents that the drug companies get for a drug, of every dollar, 25 cents goes to marketing, to trinkets, to giveaways, enough free samples to provide 10 to every man, woman, and child in the entire United States.
And how much to research?
Under 20 cents, about 19 cents. And what I think is outrageous is why spend all this money persuading doctors to prescribe inadequately tested drugs? Why not spend the money to test the drugs adequately, and then the doctors would know which drug was best?
Well, the reason is it worked. And in this case, you had a lot of doctors prescribing these drugs very quickly. They were a big money success, weren't they?
Well, it turns out to be, in our market economy, cheaper to persuade people to use drugs than to test them to be sure that they're safe and that they really work. And that is a true tragedy.
But why do the drug companies do this sort of thing, if you are right? They have been burned in the past. They have been sued again and again and again for rushing drugs out onto the market before they were safely tested. And it's wound up costing some of them billions of dollars. Their insurance rates must be astronomical.
Actually, the risks that they take compared to the profits that they make clearly make it obvious that they are investing their money wisely. They would not spend so much money on drug marketing and trinkets for doctors if they couldn't see very hard bottom lines that this is how you move drugs, not by testing. I think that also raises some questions one has to ask about the nation's doctors. If you talk to a doctor and say, well, do you listen to the drug company salesman or the advertising? They'll almost invariably, maybe we'll get some callers today, tell you, no, we don't. Mm-hmm. But why are they spending $10 billion on something that doesn't work?
Maybe it's the doctor's fault. Maybe they misprescribed these drugs in some of the cases and should have only given them to the people that it is working well for.
They share in some of the responsibility, and since I wrote this book, I've come across an even more appalling fact that was released just last week at the American College of Cardiology. Despite now 138 medical studies that show using this family of drugs for people with mild rhythm disturbances and no symptoms is dangerous and literally only effect is to kill people, nearly 1/3 of America's doctors continue to prescribe this family of drugs despite FDA warnings on the label. Now that's something wrong with our system.
Well, the FDA says we should only prescribe it in limited situations.
For arrhythmias that are life-threatening, not for people with no symptoms. But if you ask the FDA, what about the inappropriate use of these drugs, they will shrug their shoulders and say it's not our job to tell